Med History.
In 1946, after the end of World War II, a former member of the Nazi Party of Germany, a certain Hermann Wirtz, decided to create a miracle pill, an inexpensive broad-spectrum antibiotic. And Dr. Heinrich Munter, a participant in the experiments on prisoners in Buchenwald, supported and helped in the endeavor. There was a third person who worked on this idea. This is one of the creators of the sarin nerve gas, Otto Ambros. But it was not possible to do something for the benefit of the people. The trio turned out to have thalidomide, which causes serious mutations in children. Initially, all thalidomide testing experiments were performed on rodents. The mice withstood even large doses of the drug perfectly, so the scientists decided that this was enough. The magic pill, the panacea for everything at once, is ready and generally safe. In terms of popularity, thalidomide was compared only with aspirin. The latter was just bought a little more often, but the new drug did not lag behind. The only person who didn't know about it was lazy and hard of hearing. Doctors prescribed a magic medicine for literally any disease: asthma, colds, insomnia. Thalidomide was also recommended for pregnant women. He was great at fighting morning sickness, relieving irritability, and giving you a good night's sleep. It was believed that these pills were absolutely safe for expectant mothers, and even more so for future children. Children are mutants. The irony of fate was that the first victim of the action of thalidomide was an employee of the Chemie Grunenthal company, which produced the drug. In 1956, his wife gave birth to a girl without ears. But then it was considered a pure accident, completely unaware of the miracle drug. However, when the number of mutant children exceeded 100, the German doctors became seriously alarmed. At first, such congenital deformities were associated with nuclear weapons tests in the United States. They just happened to be in the 50s and 60s. It was only at the end of 1961, through the joint efforts of pediatricians from Germany, Australia, and the United Kingdom, that the truth came out. And the obstetricians continued to be amazed at childbirth. Whatever the child, there is some kind of deviation, deformities of the arms and legs, lack of limbs, auricles. But there were also problems with internal organs: the heart, liver, kidneys, genitourinary system, and gastrointestinal tract. The percentage of children with mental disabilities was also growing. The Austrian doctor immediately linked such an anomaly with taking thalidomide. He prescribed this remedy to pregnant women as an antiemetic. And the German pediatrician and geneticist Widukind Lenz described several similar cases in West Germany. Of course, the doctors decided to warn the public and sent a letter to the medical journal, The Lancet. In it, they indicated the cause of mutations in children: thalidomide. A huge scandal broke out. They decided to withdraw the medicine, but it was too late. The drug could be bought in 52 countries. You can't take it off the market quickly. The consequences of taking thalidomide were the presence of peripheral neuritis in more than 40,000 people, and more than 8,000 children with mutations were born. According to other sources, their number is more than 12,000. 40% of the children did not even celebrate their first birthday. Many parents sent their children to orphanages, left them right in clinics, just by looking at their appearance. Of course, there was also a trial against Chemie Grunenthal. It lasted 5 years. But neither the creators of the drug nor the company itself became defendants in this case, although thousands of children died, and even more were left disabled thanks to thalidomide. Everything was blamed on the imperfection of the licensing process of pharmacological agents. However, the company paid a fine and still pays benefits to German families in which thalidomide children were born. After the trial, control over the development and testing of drugs became much stricter, and the FDA licensing rules appeared. Thanks to thalidomide, it became clear that the reaction of experimental animals and humans to the same drug may be different. It turns out that mice can safely tolerate a lethal dose for humans. Why is thalidomide so dangerous? The reason is the thalidomide molecule, or rather its structure. It exists in the form of 2 isomers, right and left rotating. To make you understand, let's draw a simple analogy. Look at your hands. Right and left, they are the same only at first glance. But they are a mirror image of each other. This is also the case with the isomers of the thalidomide molecule. One rotates to the right and has a calming effect, and the other rotates to the left. And it is precisely the left-rotating isomer that is embedded in the DNA of the embryo, disrupting the natural course of its development. Thalidomide is a sedative hypnotic drug that was developed in the 1950s by the German pharmaceutical company Chemie Grunenthal. It was marketed in 1957 as a safe and effective drug for the treatment of morning sickness and vomiting in pregnant women. Effects: thalidomide has sedative, hypnotic, and immunomodulatory effects. It has a calming effect on the central nervous system, reducing anxiety and promoting sleep. Thalidomide also suppresses the immune system, which makes it useful for the treatment of certain autoimmune diseases. The tragedy of thalidomide. In 1961, it was discovered that thalidomide causes serious birth defects in children whose mothers took the drug during pregnancy. These defects included phocomelia, shortening or absence of limbs; amelia, absence of limbs, damage to internal organs; mental retardation. As a result of this tragedy, thalidomide was banned from use in most countries of the world. Modern usage. Thalidomide is currently used to treat some autoimmune diseases such as myeloma disease, lupus, rheumatoid arthritis. It is also used to treat mouth ulcers associated with HIV/AIDS. Side effects. Thalidomide can cause serious side effects, including birth defects, if taken during pregnancy, neuropathy, nerve damage, thromboembolism, formation of blood clots, liver damage, increased risk of infection. Warnings: thalidomide should only be taken under strict medical supervision. Women of childbearing age should avoid taking thalidomide unless they use reliable methods of contraception. And even thalidomide has now found its place in medicine. Since the early 90s, they have been officially treating leprosy, multiple myeloma, and other serious oncological diseases. Patients who are prescribed thalidomide are prohibited from being blood and sperm donors, as well as having unprotected sex. Women are also asked to refrain from breastfeeding and artificial insemination. They also need to take a pregnancy test once a week. Thalidomide is now under control. But what this story really teaches us is that we need not only to appreciate the precautions available, but also to be prepared for the fact that these precautions may one day not be enough. And then you should not rely on the words of authoritative personalities alone, no matter how smoothly they fall by ear. After all, if we give up reason to negligence, another tragedy awaits us.